Welcome back as we continue our women's basketball series with Banner Sports Medicine. Today I'm joined by Hannah Wengertson. She is the head athletic trainer for the Phoenix Mercury. Thank you so much for joining me here today.
Yeah, thanks for having me.
You have a cool job.
Thank you.
And yeah, I'm sure you help these athletes through all sorts of different injuries and they have a million questions about their bodies like we all do. Let's talk today a little bit about ACL injury and what it is. And is that something you deal with frequently with your athletes?
Yeah, unfortunately, ACL injuries are all too common, especially in female athletes, and we see them even at the high elite level of athletes. Usually it happens from a non-contact injury, and it's really a dynamic overload of the knee, which causes that ligament, that ACL ligament, to stretch beyond its capacity.
And it feels like what?
I guess oftentimes, I've never experienced it, but athletes will describe it as feeling a sudden pop in their knee or feeling like their knee gives out. They usually feel an immediate onset of pain and usually see them go to the floor.
Okay, and this is a hard one to recover from, right?
Yeah, definitely. The rehab process can take anywhere from 9 to 12 months, and for elite athletes, sometimes even longer to get back to their prior level of performance.
Okay, so how can you help an athlete through whether, let's just say that they even have just a minor ACL injury and not a full-on tear. How do you kind of help them through that? Are there different stretches that they can do?
Yeah, so I would say two of the biggest risk factors for an ACL injury are one, your biomechanics. So someone who can't land appropriately or control their knee during dynamic movements, we really want to work on that. And secondly is overall strength of the lower extremity, especially looking at the glutes, the quads, the hamstrings. The stronger you are, the more stability that gives your knee. So those two things really go hand in hand in preventing these injuries. Now there's two really well-known programs for ACL prevention that you can find out there on the internet that are backed by the evidence, and those are the Sports Metrics program and the PEP program. And they include a wide variety of exercises, anything from lower body strength training to plyometric activity, and will advance you from simple exercises to more advanced as you progress.
And that's probably something that's really helpful to hear, not just for your professional athletes, but for people who maybe have kids that are athletes, just so that they can really kind of educate themselves about what they can be doing to make their body strong.
Yeah, absolutely. Unfortunately, these injuries can occur in athletes of any age, so I would recommend getting started on some of these prevention programs as soon as possible.
Is that something they can do at home, or should they go and seek some medical help and guidance with that?
Yeah, I think it's most appropriate to be guided by a physical therapist or an athletic trainer, someone who can kind of teach you to do these movements appropriately with good mechanics. And then once you learn them, you can really implement them on your own at home.
Okay, Hannah, thank you so much for your time. I really appreciate it. And thank you for joining us as we continue our women's basketball series.